Joining us now from Chesterfield in Derbyshire is author and social care lecturer Joanna Buckard. Joanna, I really appreciate you talking to me this afternoon. I'm listening to Callum Bess's story, very moving in many ways. What can happen to a child if they don't get the help and support that they desperately need?
Well, coming from a fetal alcohol spectrum disorder perspective, it's important to recognise that actually it's not just the children of alcoholics that have children with this condition. There's no known safe level of alcohol drinking pregnancy. And so that means that, the children can come from any background. But in relation to not getting the right help and support, then the young people are more likely to have difficulties in life, which without diagnosis and support could lead to problems with homelessness, drug and alcohol addiction, difficulties with getting in trouble with the police and so forth.
And this can go on into later life?
Yeah, absolutely. Especially adolescence and early adulthood is a particularly risky time without that right help and support, because the young person is misunderstood. So you may have a person who talks really clearly, who sounds very able, they may have normal IQ, but their ability to be able to link cause and effect, their ability with impulse control can be affected. And of course, this means then that people are looking at behaviour as being naughty or as being antisocial without recognising that it's actually the result of brain damage.
2.6 million children are living with a parent that is considered to be an alcoholic. I mean, why do you think that figure is so high?
Well, we have to take into account the cultural perspective that we have in the UK with regard to alcohol. It is something that people see as very normalised. So when I'm delivering training to people, we talk about, people are quite shocked about the idea of people who use heroin and the effect on their children, but don't really realise that the effect of alcohol is actually permanent in terms of brain damage, and therefore much more problematic. But because we have a love affair with alcohol, people don't really take into account the level of difficulty that can cause.
We're also being told that many children are unwilling and unable to seek help that they need. Why unwilling?
In relation to if you've got a dependency on alcohol, I guess the difficulty is that acknowledgement, because it's so common. The majority of people in the UK drink alcohol at least occasionally, and because of that, it's normalised. So it can become very difficult to seek help and advice in relation to those difficulties.
And it must have a devastating impact on the whole family unit. I mean, it's not just the person who's the alcoholic and the child, but it's the extended family, and also, I guess friends too, and colleagues.
Absolutely. So from a social care perspective, if it was that social care felt that the family needed additional support in relation to parental alcohol misuse, sometimes some of the effects of prenatal alcohol exposure might be misunderstood as looking like neglect. So it may be that, social workers are coming in, looking at the situation and behaviour on the child or the effect on the child in the result of how they're living in that moment because of the impact of alcohol. But sometimes, without looking back at prenatal alcohol exposure and having those correct discussions and making sure that people around the individual are trained in order to be able to recognise the effect of prenatal exposure, to get the right diagnosis and the right long-term help and support.
Clearly an issue that's devastating thousands of lives. Do you think enough has been done about it?
I absolutely don't think enough is being done about this. So, as we said, I know that we're talking about dependent drinkers and alcoholics, but there is no known safe level of alcohol to drink in pregnancy. So this is affecting people because of the lack of information. So the lack of information that's coming from government, the lack of information that's coming from healthcare professionals, because, the Chief Medical Officer did say in January 2016 that there's no safe level of alcohol to drink in pregnancy. The difficulty is that hasn't really cascaded, and people don't, I feel, want to hear that because, they like to have a drink and they think having one or two drinks is okay, but it may be enough to cause fetal alcohol spectrum disorder. And so I don't think enough is being done.
Sure, and a lot of talk about, alcohol and our consumption of alcohol, very much a cultural issue. How do we compare to other countries?
Well, our pattern of drinking is different to some other countries, but if we look at the effects of FASD and the proportion, if we compare ourselves to South Africa, then obviously you would see much higher figures of children affected by FASD. But in the UK, the latest studies are suggesting that it is significantly high, and we're looking forward to having the first prevalent studies to give us that clear indication. But screening prevalent studies have suggested that we could have between 6 and 17% of children born with this condition. We know that studies have suggested that 41% of women in the UK drink alcohol in pregnancy. So this is something that is wide-reaching, and people don't really understand the potential consequences of low-level alcohol use in pregnancy.
Joanna, very interested talking to you. Thank you very much for your time. Joanna Buckard, who's an author and a social care lecturer. And if you've been affected by the issues in that report and in that chat with Joanna, you can contact the NACOA, that's the National Association for Children of Alcoholics. Their helpline number is on the screen.